Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. The good news is this may be one of our last COVID conversations because COVID is now entering a new phase where it's no longer a public health emergency and we have it pretty well under control. So that is really good news. So starting looking at the level of COVID around the world, it's very low, pretty much all around the world. We are still seeing some cases in places, but no place has had high levels of disease in the last 4 weeks. And there are no new worrisome variants on the horizon. This is really the only time in the pandemic that we could say this, that we have a low level of disease, no hotspots in the world, and no new variants on the horizon. And thus it looks that the public health emergency for COVID is over or nearly over. And I think this is going to lead to some changes. So we know that by May 11th, the federal emergency will have ended. I think the state emergency will have ended by then, and I think that some of the very few remaining restrictions, such as the use of masks in medical settings, will likely also be gone. This doesn't mean that COVID is gone. We're still seeing cases almost every day. I just had a message a few minutes ago that there were a couple of cases at the high school, and so the disease is still around, but at this level, almost everybody has some immunity, either because they've had the disease once or twice before, or because they've been vaccinated, and thus the severity of the disease is much lower. Take us back to 2020 when this first started. At that point, very few people had immunity. Very few people had immunization. And with that, when they got COVID, they got sick and they got very sick. And thus, in the fall of 2021 and the winter of 2022, we really had a lot of people in the hospital, a lot of people really critically ill, and many, many deaths. We're still seeing a few hospitalizations and a few deaths, almost all in people who either have never had COVID before or have never been vaccinated, and almost none of those hospitalizations and deaths in people who've been up to date on their vaccines. So the good news is that it's at a very low rate right now. We're also looking at flu and RSV. Both of those are also at a very low rate right now. So flu is nearly gone. I don't think we've seen any new cases in the last 3 weeks. And RSV, we're still seeing some cases, but much lower than it was before. So right now, it looks like things are pretty good. And if this continues, COVID will still be around. And COVID will be around as a low-level disease in the background. We have lots of these. Foodborne diseases, animal-borne diseases. We have low levels of these, but they don't really become a public health emergency because they're low levels and they're not interrupting our daily lives, and they're certainly not going to overwhelm the hospital. And I think that's where we are with COVID. So somebody says, are you sure about this? And the answer, I'm not really sure, because certainly a new COVID variant could come up at any time. The Omicron variant, which has really been what we've been dealing with for the last year, came up unexpectedly, probably in Africa, maybe in somebody who had COVID and had HIV. And with COVID and HIV, you can carry the disease for a very long period of time, and it can undergo many, many mutations, and that may have been the origin of the Omicron. So it's still possible that somebody will have Omicron, somebody with an immune compromised state get it and come up with a new variant, the beta or the theta or something, that's going to become really a problem. But right now we don't see that. And with the disease circulating a lot less than it was before, I think that's less likely. So I think we are pretty much done with this. People ask me for an analogy, and during those last 2 years, we've used a lot of weather analogies so that we're really good at telling what's happened in the past. We're pretty good at short-term predictions, but not very good at long-term predictions. So, for example, we are good at telling when the disease starts, a lot less good at telling when the disease ends. So think of winter. So you can pretty much tell that winter is here when we have our first snow or our first deep frost. But it's a little harder to tell when the winter is over. So 2 weeks ago, when the weather was pretty good, there was no snow on the ground and it was warming up, daffodils in the park, you could say it looks like winter's over, and then have this nasty weather that we've had over the last 2 weeks. And so similarly with COVID, it looks like the daffodils are up and spring is here. But this does not mean that we could not have another bad time. But we'll look at that. Right now, we don't expect that. And if we do have that, we'll certainly come back and let people know. We had one big question this week, and the one big question this week is about the origin of COVID. So where did COVID come from? I think there is pretty good ideas that originated in bats. What we've seen is that the coronavirus has circulated among bats, and a very close relative of COVID-19 was seen in bats in China. I think pretty much everybody agrees on that. But the intervening steps between the bats in China in caves far away from Wuhan to the first cases in Wuhan, I think, are really, really unclear. And the reason it's unclear is that the Chinese government has not been particularly helpful in helping us understand what happened. So what are the possibilities here? So the possibilities are that it was in bats in China. They were working on these bats in the lab in Wuhan. They manipulated the virus and then deliberately let it go in China to see what would happen. I think everyone who has looked at this thinks this is really quite unlikely. The other possibility is that there were bats in China that had this, studied at a lab in Wuhan. It spread to one or more of the workers there, probably accidentally. I don't think they purposely infected themselves. And then those people got it and spread it to other people in China. This is certainly possible. We certainly know that there have been accidental spread of pathogens from labs to people, not just in labs in China, in labs in the US and labs elsewhere. But it turns out that in most of those cases, when those spreads have happened, it's not a particularly contagious disease, and it doesn't go any further. So that's certainly a possibility. Another possibility is that it was leaked in some other way. One of the bats escaped or something like that happened, and then it spread it to people in Wuhan. There are other possibilities too. It's certainly possible that the people who were collecting the bats and selling them to the lab had extra bats and decided that they were going to go ahead and sell them in the market in wet market in Wuhan, where they actually were selling bats, and it spread in that way. And so we're not really going to know. And we've had a bunch of intelligence agencies look at it, and they've given lots of different advice about what had happened. Was it totally benign spread from bats to people? Maybe. Was it an accidental release from the lab? Maybe. Was it a deliberate release? I don't think anybody is suggesting that it was a deliberate release. But nonetheless, this tells us that when we have labs that are working on these very dangerous organisms, and COVID is certainly dangerous, but there are other ones out there that are equally dangerous. I think smallpox, Marburg, Ebola, all of these things that we worry about are equally dangerous and worrisome. And that's why I think we have to be incredibly careful when we do have these labs, that they have the very highest standards of safety. And the best way to have these high standards of safety is for countries around the world to work together. And sadly, we've not really had that over the last several years. And thus the possibility of other diseases escaping from labs is certainly something we in public health pay attention to. The good news is that certainly locally, we don't have any labs dealing with tough stuff like that. And the labs in Oregon that deal with that are not dealing at the really high levels. And from what I've seen, appear to be very safe. So when anybody says they know where this came from, I think they are making it up, because unless they have new or different information that is publicly available, there's no way to know for sure. But could it have come directly from bats to people? Absolutely. Could it have come through the wet market? Absolutely. Could it have come through an accidental release at the lab? Absolutely. And I think we may never know. But I think we want to be careful in the future to not have another episode like this. Again, this is Dr. Bob Dannenhoffer. COVID Conversations. We're going to go on holiday for a few weeks. If everything is quiet, we'll probably stay on a holiday. Certainly, if something happens along the way that people need to know about, we will open up again and do another COVID conversations. I've got a lot of nice comments for our COVID conversations. Thank you for all the nice comments, and thank you for people who have been so kind and generous with us, because we really haven't known everything all the time, but we certainly have tried as hard as we can to get you good information in a timely way. Thanks so much.